Hello everyone, welcome back to my channel. Today we will talk about patient history. The art of medicine is to determine why a patient has sought help. The key skills to help establishing the underlying cause of a patient's symptoms is based around talking to the patient, the examination and requesting tests like blood x-ray. Basically, all these are called investigations. The information gathered from the history and examinations are used to form a hypothesis of the underlying diagnosis. Investigations can then be used to either confirm or refute the diagnosis. Some diagnoses can be made just by talking to a patient, while others can rely on the investigations on the particular tests. During medical school, you learn the art of taking a formal history, examining a patient, and interpreting investigations. The history is considered the most important aspect of the interaction between patient and the doctor. It is the cornerstone of the doctor-patient relationship and relies on a good communication skill. So the most important thing while taking the patient history is good communication skill. Most information about a patient can be determined by the history alone. Here we will describe the basic structures to history taking in medicine that is used by all clinicians to gain information from a patient about their condition. Now we will talk about history structure. Taking a history from a patient is an essential skill for all the clinical. The history has a well formulated structure to help determine the patient problems in a logical order and to establish other relevant information. It also helps to signpost key parts of the history and provide subheading when presenting information to another professional. Like we are discussing the problems of a particular patient to another, so in that case also, so the patient history plays an important role. This is the basic structure of the history. First, presenting complaint, then history of presenting complaint, then past medical history, then drug history, family history, social history, systematic review, and finally ideas, concerns and expectations. All these points we will discuss in the further slides. So now presenting complaint. The presenting complaint should be single sentence that describes the reason why a patient has sought help, why he wants help. An example of a typical presenting complaint would be abdominal pain or headache. The presenting complaint should capture key information about the patient that helps to focus the history, including age, sex, and timing of the complaint. This information helps to focus the potential list of the cause. Now, I will give you an example. 88 years old female presenting a 1 month history of abdominal pain. 23 years old male student presenting with a 12 hours history of headache and fever. 56 years old male heavy smoker presenting with a single episode of coughing up with blood. Now, the history of presenting complaint. The history of presenting complaint is the key part of the history of which the clinician should spend most of their time determining the nature of the complaint. You should ask a series of both open and closed type of questions to clarify the problems which the patient has been facing. And the key questions may include like, could you tell me more about this symptom? How long has this symptom been affecting you? What makes the symptom worse? Is it associated with any other symptoms? So all these questions you can ask in history of presenting complaint. In general, the history of presenting complaint can be targeted depending on the presenting problem. You always need to determine the chronicity and associated features of any problem. If it is pain, you need to take a pain history. If the problem is related to particular system like lung, heart, you need to ask system specific questions as well. Now, duration of symptoms. It is essential to determine when the problem started, how long it has been going on, whether it is constant or fleeting, or whether it has been worsened or getting better. So all these questions you need to ask to the patient. Associated symptoms. Always ask about associated symptoms like nausea, vomiting, breathlessness, fever. As you learn more about clinical medicine, you will learn what the important questions are to be asked. These are just some of the examples which I have described, but there are a lot of questions which practically when you will take patient history, slowly you will get that. Pain history. Pain is an extreme common symptom and it is essential that all clinicians can take a good pain history from a patient. The key parts to a pain history can be remembered by there is a word, Socrates. By this you can remember how you are going to take the pain history. See, S stands for site of pain, O onset of pain, C character of pain, R radiation, A associated symptoms, T timing, E and relieving factors, S severity. So on the basis of all this you have to take the pain history. Now system specific questions. These are group of questions that should be asked when a patient presents with a particular complaint. They can be grouped based on organ systems like cardiovascular, respiratory. These are discussed more in our other clinical history notes. Now, past medical history. While taking the patient history, you have to ask the patient about its past medical history in order to prevent the interaction between the drugs. The past medical history is used to determine any previous medical or surgical problems that the patient has been within his lifetime. It is important to determine each problem, when it is started, the treatment required, and whether there is any ongoing follow-up or not. Two examples are given below. Myocardial infarction diagnostic in 2006, underwent percutaneous coronary intervention, had two stents placed, seen in cardiology clinic yearly. Now, the medication history is used to establish what the patient is taking, including both prescribed and over-the-counter medications. For all medications, you need to establish the name, dose, frequency, and route. All this we are talking about medication history in patient. While taking the patient history, how you are going to ask about the medication history, what kind of the four things you have to ask while taking medication history: about the prescribed medications, over the counter medications, herbal remedies, and recreational drugs like cocaine. Now, family history. You have to ask about family history as well. Taking a family history is essential to determine illness that run within the family or may be inherited. When gathering a family history, you need to find out the condition affected by the relative, the age at which it was diagnosed, and the relationship to the patient. A family tree can be used to help represent this information. For example, mother, first degree relative, lung cancer diagnostic at 45, maternal aunt, second degree relative, diagnostic breast cancer at 32, father, first degree relative, diagnostic hypertension at the age of 65. So, like this, you can take family history. Now, talking about social history, the social history is one of the most important components of medical history. The purpose of a social history is twofold. One, you need to find out relevant information about home, domestic activities, job, financial security, travel, smoking, alcohol consumption. All this comes under first. Now, in second, you need to consider the effects of their medical conditions on these social issues. For example, poor mobility due to heart failure, need care due to dementia. The key parts of the social history can be remembered by using the word LOLASDIET, where L stands for life. Who does the patient live with? O. Occupation. L. Living. Activities of daily living. A. Alcohol consumption. S. Smoking history. D. Diet. E. Exercise. And T. Travel. Now, activities of daily living. This refers to what the patient can do for themselves and how any illness can be affecting them. It is important to determine information such as whether they can wash and dress, can they go to the bathroom by themselves, do they have any carrier, do they walk with any stick or frames. Now, alcohol consumption. This needs to be quantified based on weekly average of alcohol intake, that the person is taking alcohol or not. If he is taking, you have to measure like how much alcohol he is consuming per week. The national average for both men and women is now 14 units per week, with several alcohol free days, maximum of 3 to 4 units in any one day. Now, talking about smoking history. Smoking history is described in the number of pack years. A single pack year is equivalent to smoking 20 cigarettes a day for a whole year. Therefore, if someone has smoked 20 cigarettes a day for 40 years, they have a 40 pack year smoking history. This can be explained from the formula: pack year equals to cigarettes smoked per day upon 20 into number of years. Now we will talk about system review. The system inquiry is a way of screening for any another symptoms related to major symptoms within the body. The symptoms review can be completely at any point during the consultation, but it is usually completed at the end or following the history of presenting complaint. It is important to ask brief, closed questions to ensure you cover the major symptoms in a timely fashion. However, a positive response should be further investigated fully, like in the history of presenting complaint. The best way to approach the systems review is to start by asking four general questions and then ask short closed questions from head to toe. The four general questions are useful to screen the malignancy or chronic information like weight loss. Have you had any significant weight loss? Fever. Have you had any fever or night sweats? Energy. Have you had a reduction in your energy level? Appetite. Have your appetite changed? The short closed question from head to toe may be followed as headaches, virtual changes, hearing problems, swallowing problems, chest pain, shortness of breath, abdominal pain, urinary symptoms, bowel symptoms, skin rashes, joint pains. So all these can be asked. Now, ideas, concerns and expectations. This is the last point in the structure of patient history. At the end of every consultation, you must inquire as to the idea concerned and expectations to the patient, which can be shortened to the ICE, which like it can be denoted by the word ICE, where I is ideas. Like, do you have any idea about what could be going on? Ideas refer to the patient own thoughts about what the problem. Ideas refer to the patient's own thoughts about what the problem could be and helps to guide your own diagnostic process. Now, C stands for concern. Like, is there anything which is concerned you at this moment? It is good practice to address any concern a patient has during the consultation. It also helps to provide reassurance and offers time for the patient to ask any question that might have. E stands for expectations. So we already talked about ICE. So now E stands for expectations. Was there anything you were hoping for from our discussion today? So this is the end part of your patient history. It is important to establish the patient's expectation during or at the end of consultation. For example, a patient presenting with a viral illness may be expecting to get antibiotics. So all this was about patient history, how you are going to take, what are the different points. Thank you.